Hello, my name is Laura Gill. I'm the founder and the clinical director of the Attachment and Trauma Treatment Center for Healing. Today is World Suicide Prevention Awareness Day, and I wanted to share some information that I hope will be helpful for you for raising awareness, giving you some tools to support anyone that you know that may be experiencing suicide ideation, and also providing some resources and strategies that may be helpful as well for anyone who's struggling themselves. When we talk about suicide, we know that this results from overwhelming pain. A friend and colleague, David Mascar, included this in one of his books, and I think it's a great depiction. It shows us that, we have these hurts in life as human beings. We experience hurts, and some of us have more than others, and some of these hurts are bigger than others. But what happens ultimately when we have this tremendous pain is there's an overwhelming need to escape, and when we don't know how to escape it, that pain tends to build up. And if we think of suicide as an option, what happens is as the pain increases, there's a narrowing or a constriction that occurs, and that increases lethality and risk. I'm here today to talk to you about some of the warning signs, but also some of the resources. As a trauma therapist working with people who have suicide ideation quite often when they come to see us, I want to share that there is hope. We see people healing all the time, and we can reduce the pain and stay embodied in a safe, structured way. There are ways to move through the overwhelming pain that is there, to lessen it. And that really becomes the goal when we're looking at overwhelming pain, is looking at how do we reduce the pain, because people are desperate for that pain to be reduced. We also want to be mindful of warning signs. There are many different resources out there, but this is one that I've used throughout my career called Is Path Warm? And it says, when we're looking at suicide ideation, first of all, is there ideation? Are there suicide thoughts? Is there substance use, increase in alcohol or drug use? When we're using alcohol or drugs, it increases impulsivity, which increases risk. Is there a sense of purposelessness? Does somebody feel like they have no purpose in their life or no reason for living? If so, how do we bring about a sense of purpose, a sense of connection? If there is a sense of anxiety, somebody seeming more agitated or restless or having difficulty sleeping, again, we want to look at how can we reduce that anxiety. And there are lots of practical techniques and strategies that we can talk about here and that are also available on other platforms to help with reducing anxiety. Trapped, does the person feel like they have no other options? Again, suicide ideation is typically about this tremendous pain and wanting the pain to stop, but not knowing how to bring that about. Hopelessness, helplessness, sadness, depression, right? All of these things help to increase the pain that's being experienced and increase the sense that they can't fix it. And this is where there are professional resources to help with some of these intense emotions and to help you learn to work through those things that are causing the intense pain in a safe, structured way, in a way that also reduces the intensity of what's being experienced. Withdrawal. So an individual who withdraws from family, friends, society, this is a warning sign and something that we want to be mindful of. Now, especially during the pandemic, we know that people are even more isolated than they typically have been. Programs have not been running. They haven't been able to connect with family that they previously perhaps did. It's not been easy or accessible to see people. And I think it's so important that we're aware that even though there's been this kind of disconnect that happened, there are still ways to connect, either through resource installation or online virtually. A lot of programs are adapting to run online, and some are even reopening now. But this is all really important to help increase connection. Check in with people that you know. Spend time with them, even online, through the phone, face-to-face if you're able to do so. Mindful walks, having tea together or a cup of coffee is a beautiful supportive way just to see how they're doing. Anger. Having angry feelings or uncontrollable rage feelings. Often this ties in with big energy that's building up in our body that we don't know how to release in a safe, effective way. So this anger is, anger in general tends to be protective. So when we're seeing that, we want to understand what's underlying it, what's causing the person to feel fearful or in need of protection, what's causing the pain or the activation in the body. And then we want to learn how to discharge it in a safe, effective way. So shaking it out, stomping it out, throwing a yoga ball against a wall. All of these are good techniques for vigorously and intentionally discharging that excess energy in a way that doesn't hurt self and doesn't hurt others, but does effectively reduce that arousal level or that energy that we're feeling in our body. Noticing and naming what we're feeling as well is another great technique. So even just noticing, right? I'm feeling anger in this moment. Anger is part of the human experience. May I offer myself validation in this moment? May I offer myself kindness, right? Whatever feels like it is needed. This can be a beautiful way to validate the big emotions that are coming up. Recklessness. Individuals engaging in risky behaviors without thinking of consequences. I often refer to this as death-seeking behavior, right? They're gravitating towards things that are dangerous, that might result in the end of their life, even though they aren't perhaps saying that they want to die. They're engaging in behaviors that increase the likelihood that this will come about. And we want to be really mindful of this and be able to explore this with people and express our concern in a supportive way that says, I see this, it worries me, how can I help? Mood changes, drastic changes in mood. And this could also be people all of a sudden seeming better. Now, as parents and caregivers, of course, we want to see this. Of course, we want to see our loved ones, who have been suffering and struggling to be feeling better. But we want to be mindful that if nothing has changed, medication hasn't changed, they haven't started therapy, there have been no significant life changes, and all of a sudden their affect and their mood changes, we want to be curious about what's happened here. How come this has changed? And explore that, because sometimes what's happened is people have identified with this as a solution, and that feels like relief to them, right? What I really want to emphasize is that, sadly, some people do die by suicide. It's tragic. It really, really is. But I also know, and I see all the time, the tremendous capacity that we as human beings have for healing, for reducing the pain, for learning new techniques and strategies, for learning how to live in a more embodied, authentic way that feels good and true and real. And I do hope that this offers some hope. When it comes to helping others, we want to avoid making judgments or giving solutions. People really just want you to listen. They want you to hold space and be compassionate and curious. You don't have to fix things. You don't have to know the answers. But being able to express, like I said, the concern that we see, and tell people you see them, you see their suffering, and you're sorry and you want to help. How can I help? Is so important. And when we do this, it delivers two really critical messages. It says, I take your problem seriously and I care enough to want to help. I see you, I see that you're suffering, I care and I want to help. What a beautiful message that is for people to receive. It's also important to learn about suicide, learn about the warning signs, learn about how to be, a safe helper. There are great programs. Safe Talk is a program that's run often through the local distress centers that teaches people how to be a safe, aware helper. Just people from the general public to increase your awareness about talking about suicide and being alert to the signs. Assist is another great training often offered through the distress centers in our area at least. And that one's a little deeper dive and a little bit more clinically focused. QPR, Question, Persuade, Refer is one that we'll look at next, and mental health first aid training. So these are just a couple. There are many different resources out there. We offer a training as well that's a little more clinically focused, that takes a bit of a deeper dive as well. And then I also present a course for the National Institute for Trauma and Loss in Children that is an online course that speaks a little bit more to the suicide ideation and intervention and postvention. I like the model of question, persuade, refer as a practical resource. And really, what they say is when to ask is anytime that you're unclear or you're in doubt. If you feel like you're worried for somebody's safety, for their well being, ask. It doesn't cause harm to ask. Talking about suicide doesn't hurt people. Not talking about it does. If you're wrong, right? But at least you've asked and you've let that person know that you see them. Anytime someone causes you to feel any discomfort or concern for their safety, it's okay to directly ask. And it is important to directly ask, are you thinking about killing yourself? Are you thinking about ending your life? If they say yes, you don't have to fix it. You don't have to be a therapist or a clinician, but you do need to know who to refer them to. So with QPR, the idea behind it is to ask the question, persuade them to stay with you and allow you to link them up with support and refer them to somebody who can do that work. There are distress centers and crisis lines available throughout the world to help provide support. So we want to link people up, right? The sooner we can do this, the sooner they're going to have access to resources and treatments that can help with the tremendous pain that they're experiencing. Really want to be mindful of not leaving people alone. So if you're getting help, stay with them, right? Or have somebody else stay with them. Get a professional involved. That professional can help create a safety plan, or if you're with them, you can ensure that that they're safe until support is available to do that. But really, please be sure that you're not agreeing to keep a suicide plan a secret. People, like I said, are experiencing tremendous pain, and what we want them to know is that there are resources, there is hope, there are people who can help them, and this pain can lessen. At our center, we work on treating the underlying issues, right? Sometimes people worry that if people have suicide ideation, doing therapy will cause greater problems. But what we see is actually the opposite. When there is this tremendous pain, when there is this tremendous hurt, we want to get in there and treat the underlying hurt. We want to treat what is causing the tremendous pain so that we can alleviate it and start to, live life in a more optimal manner. It is possible. We see it all the time at our center and often in as little as 4 to 5 sessions. So hope and help is available. And if you are having thoughts of suicide or wanting to die, please reach out to your local crisis service and know that there are resources available. Please, feel free to reach out to us as well if we can be of any assistance. We are not a crisis service, but we certainly will provide support or strategies whenever we are able to. I'll be linking up a variety of resources and strategies that can help with those intense feelings as well. And if you have any further questions, please feel free to post in our comment box and we'll get back to you as soon as we can. Wishing you a gentle rest of your day, and thank you so much for watching. There are a wide variety of resources, emotional regulation tips and techniques, mindfulness practices available on our website to help with some of the intense emotions that people may be experiencing. And that's Attachment and Trauma Treatment Center for Healing. And you can find that on YouTube. And we also have a Caring Community Connections group on Facebook that is designed specifically to help reduce stress, increase connection, reduce anxiety and feelings of isolation and overwhelm. And I really do hope that some of these resources will be helpful to you.